Hello and welcome to this new episode of Santé Plus. Today we are on the premises of MIOT Rehab Center in Port Louis, which was launched on Friday 18. And today we have with us as well Dr. Prithvi Mohandas, the Managing Director of MIOT International India, to talk about this new project. Hi, Doctor.
Hello. Pleasure to meet you.
It's not your first visit here in Mauritius. So can you tell us more about the relationship between MIOT International India and Mauritius, how it evolved over the years?
Sure. So we've been closely associated with Mauritius even before COVID started, but obviously for the last 3 years, we've been receiving up to around 20 patients a month from Mauritius for difficult treatments or complex treatments that unfortunately are not available here. These are patients either who are private or insured or are sent by the Ministry of Health. So we've had a very close relationship because of that. And recently, in partnership with the Ministry of Health, we've also partnered to provide certain specific treatments via the Ministry of Health for patients in Mauritius, things like kidney transplant, etc.
And today we are here for the launching of MIOT Rehab Center. Can you tell us how it all started?
So rehabilitation is an essential part of the patient journey towards complete cure. And even though India is such an advanced country in terms of healthcare, and we have patients being treated through the length and breadth of the country using modern technology, rehabilitation has taken a back seat for a long time in India. For many years, we only had one rehab center in New Delhi, and then the second rehab center was opened in MIOT Hospitals, Chennai. Especially during COVID, this center saw many patients come for rehabilitation to get back to their normal lives after suffering from COVID. And after that, we started seeing patients locally from within India as well as from overseas coming to us for specific treatments in Chennai, treatment for stroke, treatment for childhood disorders, difficulty walking, cerebral palsy, etc. So it's been a very, very satisfactory journey in terms of patient outcomes.
And what inspired the launch of MIOT Rehab Center here in Mauritius?
I think we've been looking to see what can we do in Mauritius to make a meaningful difference to the people of Mauritius, and we wanted to select something that wasn't already there. We see that people are starting beautiful hospitals here. You have top-class equipment, you have excellent medical talent. But the one thing that seemed to be missing was getting the patient, after initial treatment, to fully normal activity. And this target is a target that the patient gives you. So a lot of patients who've been treated in India who are from Mauritius may have come to India with problems in their brain, problems in their spinal cord. Some of them have cancer. Some of them have blood vessel problems. Some of them have an old injury. And these patients have had big, complex surgery, but they're not going back to normal life. They feel that they're only 50% back to what they were doing before. The balance can be achieved with targeted, comprehensive, collaborative, multidisciplinary rehab, and it can be provided very easily in your own doorstep. And therefore, we decided, let's do this in Mauritius.
And what makes it the first of its kind?
Well, a lot of people in Mauritius who have a stroke or who are bedridden, a lot of children in Mauritius, maybe they've been born with an injury because of lowered oxygen to the brain, maybe they have cerebral palsy, maybe they have autism. These people are not going back to normal life. And a lot of them are going overseas and coming back finding that they're not normal either. So we thought this center, which has multidisciplinary people with modern technology, will be able, for the first time in Mauritius, have a dozen specialists who are specialized in each part of the patient journey to get them to normal activity. Say, for example, you've had a singer who has a stroke. There's no use letting this singer go back to feeding himself, putting his clothes back on himself, and to be independent at home. The person needs to be able to sing. The patient will need voice therapy. This patient needs specialized nerve regeneration and voice treatment so that they can earn a livelihood. A teacher who's teaching in a classroom has had a fracture, treated very well in Mauritius, but He's now not able to hold the chalk. He's now not able to lift his hand and write on the blackboard. So these are the things that need specific collaborative rehab, which is what makes this center unique.
And as well, the continuous care beyond hospital treatment?
Yes, once you're treated in the hospital, the treatment is usually for major things. Maybe you've had surgery. Maybe you've had some kind of therapy that involves giving you injections, and you're sent home saying your treatment is over. But you feel that you haven't achieved cure. For cure, you may need a team of people who work together to achieve what you feel is the goal you want to achieve. So a patient, for example, a simple scenario may be you've had knee replacement. Your knee has no pain anymore, but you live on the first floor. You're finding it very difficult to go up and down. You would like not only to have no pain, but also to be independently mobile. You don't want to sit down and say somebody else goes up and fetches something for you, or if your bedroom is in the first floor, that you have to move it to the ground floor. So this sort of rehabilitation has to be targeted with the patient in mind. We need to know which specialist to draw upon, whether it's somebody or some machine that needs to hasten your recovery. Is it muscle that's weak? Is it nerve that is weak? Is it confidence that is not there? Is it a combination of a psychologist as well as a physical therapist? These are the things that are required for you to fully get back your version of complete cure.
Now, talking about a specialist, can you walk us through the multidisciplinary team that you have here at the center?
Absolutely. So each patient needs a customized program that is meant for them so that it will achieve their specific goal. So you have the head of the team who has a medical degree, which is a master's in rehabilitation medicine, what is called a physical medicine degree, leading the entire team. The team sits together and first listens to the patient complaint and then decides who are all required in the journey. Patient may come to us saying they've got a problem. It may be a child with, say, cerebral palsy. Then we need a neurophysician to be included in this consult before the treatment plan is given. Maybe it's a child who has a little bit of autism. Then we need a child psychiatrist to be included. For this, we may have to connect with Chennai and get their input. We may need a patient with a weak nerve to have nerve stimulation, or weak muscle to have electrical muscle stimulation. So for each of these, there's a different person. And at the end goal, if it's a particular specific occupation needing fine movements, we also need to involve an occupational therapist. So the person is given either a 42-day program or a 90-day program, and with specific goals that they will achieve every week, so that they themselves feel that they are achieving it, and they will go through various machines, balance machines like the Ballo, machines that help you if you've been lying in bed for a long time like the tilt table, machines for patients who have not walked for a long time like the get up and go. So these machines will also be introduced in your treatment.
Yeah. And what about the treatment plans? Are they personalized?
Yes, everybody is different. Every reason for rehab is different. So if your reason for rehab is because you've had a stroke, depending on which areas are weak, the machines used will be different, the specialist will be different. So say, for example, you've had a stroke, you're first assessed with nerve conduction studies, which can be carried out here. And they tell us which area is working and which is not working. And then the areas that are not working are targeted. Sometimes they're even targeted with visual reality therapy, which we have here in the rehab center in Mauritius.
Yes, my next question will be about that. Can you tell us about the advanced rehabilitation technologies and equipment available here in the center?
One of the groundbreaking areas is getting a paralyzed patient walking again. The big problem with paralysis is gravity. When there's gravity, the paralyzed patient feels that he's always going to fall, that his muscles are going to crumple under him, that his leg will give way. For this, we have gravity-assisted machines that cancel gravity. We have harnesses that support the patient so that as the power in the leg slowly increases, they don't lose confidence. The harness initially completely supports the patient while the patient stands, while the patient walks. And in the beginning, the treatment is stationary. That means the patient is not made to really walk on the ground, but maybe with the use of a motorized treadmill to move the legs And with the harness to cancel out gravity, the patient is made to stand and then walk. And then slowly we detach the frame from the treadmill and then get the patient onto the floor, walking without a treadmill, and then eventually remove the harness, give the gravity back into the patient's body, and make them walk totally unaided.
How does the center ensure accessibility and convenience for patients with mobility issues?
From the time the patient gets down from a vehicle, this center is accessible. There's a ramp so that from vehicle to the center you can reach in your wheelchair or in your stretcher. And then once you enter the doorway, the big step that is there, there's a second ramp that will take your wheelchair in or your stretcher in. After you're finishing one treatment to the next, if you need recuperation or you need a recovery time, there's a big observation area. You can be connected to specific gadgets for observation and then resume your therapy. There's an excellent disabled toilet for differently abled people with their disability devices to enter along with their wheelchair. It's very, very large. It's got special rails to ensure you don't fall so that you can have a comfort break and continue your treatment.
Okay. So, doctor, let's now talk about the next-gen telemedicine here. Can you tell us a little bit more how it enables real-time consultation with specialists from MIOT International India?
So the problem with collaborative care is that every single specialist can't be sitting in the place all the time. You may have a patient who has other things wrong with them, and therefore you draw other specialists in for discussion. It's very useful in real time if you can draw people in so that the patient is able to connect and trust the treatment that is being planned for the patient. So when we're sitting with a patient after the rehab board is met and we think that we need another specialist and the specialist is sitting in Chennai, we get the patient onto the telemedicine kiosk. The telemedicine kiosk is not any other video call type telemedicine. You can connect gadgets into it. So the patient may have a specific problem in the ear. We can connect a gadget into the patient's ear so specialists can look into the ear of the patient. The patient may have a problem and patient may need an ultrasound. We can connect the ultrasound machine directly into the kiosk so that while it's being performed, the specialist can view what is wrong with the patient. So there is a real-time diagnostic consultation that will result in an explanation that the patient is able to understand and a plan that the patient is able to trust.
Okay, thank you. To close this interview, doctor, do you have could you share with us some of MIOT success stories maybe?
So there are several success stories. One of the most incredible success stories is that of a young man in his 20s who was finishing university and was involved in an accident which broke his backbone. He had excellent, successful surgery to put the backbone back into a stabilized situation, but he lost all feeling below his belly button. So his legs were paralyzed. He came to us. We started therapy for him. We started doing nerve stimulation, muscle stimulation, get up and go, gravity cancelling walking device. Within 2 months, he'd improved. And in 90 days, he was back swimming, back playing badminton, and now he started a job and soon he's going to get married. So these success stories give us satisfaction, give other patients hope that there is definitely going to be a light at the end of the tunnel.
Okay, thank you. Thank you very much, Dr. Mohandas, for sharing these insights with us.
Thank you.
So thank you also for watching. Stay tuned for updates about healthcare in Mauritius. Thank you.